So, good afternoon, everyone. My name is Adrienne Burgess. I am the Senior Director for Innovation in Patient Safety and Quality at the Maryland Patient Safety Center, and I'm here with my friend and colleague, Megan. Megan, do you want to introduce yourself?
Yes. Hi, everybody. I'm Megan Ockett. I am the program director with Healthy Birthday Inc., the nonprofit organization that created Count the Kicks, an evidence-based stillbirth prevention program that you're going to learn more about today. Excited to be here. I am calling in from Iowa, where we are based. And as if you just are joining, I was sharing with Adrienne and the group here that to go to a beach, like to go to the Pacific. So I'm sorry for all you Eastern folks. So.
So, Megan, I just want to make sure you can still see the waiting room because, as I mentioned, I have been blocked out from the waiting room. Are you still able to see it to let folks in?
Yep, I'm good. I'm letting folks in as you talk.
Okay, perfect. So Megan and I have kind of set up the presentation that I'm going to get us started, and then she's going to come in a little bit later on, and then we'll use the second half of this presentation to really dig into the implementation resources that we shared with you. We wanted to use the beginning of this presentation to really dig into the history of fetal movement counting, why this is all important, and hopefully to give you a more in-depth understanding around both fetal movement monitoring as well as how Count the Kicks came to be. Because I think that that's helpful in terms of when you're educating your staff, working to get buy-in. I think it's just helpful when our site champions have a really in-depth understanding about why we do this and why we feel it's important. So just to start, stillbirth by the numbers, 1 in 177 U.S. pregnancies end in stillbirth. There are significant disparities in this outcome. As you can see, rates of stillbirth are higher among Native Hawaiian and other Pacific Islanders, as well as among Black pregnancies. We see this data true across the U.S., and we have seen this in Maryland as well. In Maryland, the rate of stillbirth is about 6.44, so 6.44 per 1,000 live births. And each year, Maryland loses approximately 450 babies to stillbirth. So some things that as I've been learning more and more about this, so just for a minute to share that, I came into this when I came to the Maryland Patient Safety Center. I was working on a project called Birth Equity. Some of you might be familiar with it. Birth Equity is a program that supports non-obstetric providers in understanding about severe maternal morbidity, helping them to understand disparities in maternal health outcomes, and engaging in that work. And so the work of Count the Kicks kind of, to me, felt like a companion program to that, because it really does address disparities in outcomes, promotes health equity, and really does tie to severe maternal morbidity. And I'm not sure that everyone always understands that tie. And there's some pretty dramatic data around how stillbirth is a significant contributor to severe maternal morbidity. Stillbirth has been associated with increased rates of severe maternal morbidity starting at 31 weeks gestation, and non-transfusion severe maternal morbidity at 30 weeks. There's been some unfortunate recent stories in the news media about folks dying after stillbirth. This can be related to many different factors, but our thought here is that if we can prevent stillbirth, we can prevent SMM. So really thinking of all of this, all of our work around preventing severe maternal morbidity and preventing stillbirth as one effort. And that's been really, really powerful for me as a way for providers, nurses to really think also when we have a patient that experiences a stillbirth, because not all stillbirth is going to be preventable, but when we have a patient that experiences a stillbirth, really recognizing that that is a risk factor for SMM, and we should be really thoughtful around how we're following up on those patients and teaching them about the urgent maternal warning signs. So I would gather that all of you are well aware of this already, but just to reinforce that stillbirth has significant impact on both physical, psychological, as well as a economic burden that's often like under discussed. Patients who experience a stillbirth do have an increased rate of severe maternal morbidity, as we just discussed. It's about fourfold higher than those who have a live birth. They can have prolonged and complex grief. Both the patient as well as the family can experience this. And then there's this financial burden that can impact families due to time off from work, medical bills that may be associated with the stillbirth, as well as, due to that prolonged and complex grief, there may be ineffective coping, use of substances that could also impact their ability to continue to work. So I think it's really interesting to think about why we want patients to monitor fetal movement. So when I first started this, I knew that we always talked about it. I mean, I've been a nurse for 27 years in all different areas of maternal child health, and we always talk to our patients about, counting their baby's movements. But as I started to think about it more and more, I realized that we all do it a little bit differently. And I can't say that I ever sat down and really thought through why we do it. I mean, I know that we always thought it's a sign that, the baby is being perfused well, but never really dug into the history of it. So it's hypothesized that much of stillbirth occurs due to placental insufficiency. So when you have placental insufficiency, there may be acute or chronic fetal hypoxemia that is associated with that. And makes perfect sense that as the baby is being less and less oxygenated, its movements may decrease as the fetus slows to conserve energy, and thus a period of decreased fetal movements precede death. So there's been some studies around this, and in one case control study that compared 153 individuals who had experienced stillbirth with 480 people with ongoing pregnancy or live delivery, those who had stillbirth were much more likely to have reduced fetal movements in the preceding 2 weeks. And so I call out preceding 2 weeks because this isn't always just right before the death occurs. These patients felt the reduction in their fetal movements in the 2 weeks prior to their birth, meaning that there's time. There's time for them to seek help. There's time for us to listen. There's time for us to do further testing. So meaning that us teaching them about fetal movement can provide the opportunity for us to identify babies at risk. So we've been recommending fetal movement for a long time. For those of you on the call that have been in this field, you can probably think back to the beginning of your career and know that we've been talking about this in prenatal care since the 70s or the 80s. But there's little standardization around to whom and how fetal movement is taught. So Megan and I and another colleague of ours, Sarah, we wrote an article just kind of looking into the history of fetal movement counting and, what's been going on around fetal movement counting for a long time. And, a lot of the meta-analysis that pull together all this research, have people giving written instructions. Sometimes they give charts. Sometimes they tell them to count at nighttime. Sometimes they tell them to count after a meal. Sometimes they tell them to lay down. Sometimes they tell them it doesn't matter. So there's all different variations in who we tell to count fetal movements, how we tell them to count, what type of support, instructions, all different variation. But there's two main methods, excuse me, in how we count fetal movements. The Sadowski method, which assesses the number of movements that the baby's made over a period of time. So we might say 30 minutes or 2 hours is a common one we usually hear. And it's typically after meals. So when you hear 2 hours, that's a long time. Think about how difficult that would probably be for a pregnant mom to sit down for 2 hours and pay attention to their baby's movements. The card of count to 10 is really what Count the Kicks is kind of founded off of, and it's assessing the amount of time it takes to perceive 10 movements. Now, with the Sadowski method, think about it. We might say assess the number of movements. Often we give them a limit, like say, how long does it take to, in 2 hours, you should get 10 movements. Um, we haven't really we don't have strong evidence to clarify any of that. So that is why Count the Kicks is really using the card of count to 10, because we're really working to establish what's normal for your baby, because every baby might be a little bit different. So we know that public health campaigns have significant effects. Like a common one that we know has been really impactful is the Safe to Sleep campaign. So the campaign that we told people to do the ABCs, to think about putting their baby back to sleep. That was what we heard for years and years, and it has worked. It has dramatically reduced the number of babies that have died due to SIDS or sudden unexpected infant death. So public health campaigns definitely can work. Each year, over 21,000 babies are born still in the US. This is approximately 7 times the number of those lost to sudden unexpected infant death. Now, we are in no way saying that one issue is more of a crisis than the other, but just saying in terms of numbers, I think this quantifies that stillbirth is a public health crisis and a concern that we need to take seriously. There have been public health campaigns aimed at reducing rates of stillbirth in other countries like the Netherlands and Australia. So it's time for the US to start thinking about how we can really get behind preventing stillbirth. So, in terms of how do we think of things that require public health campaigns, they need to be a significant issue for society, birthing people, their families. We can definitely see that stillbirth is a significant issue on all of those counts. There is opportunity to prevent it. Not all stillbirth can be prevented, and that might be some of the comments that we get from folks that we can't prevent this. There is opportunity, as evidenced by the research that we shared previously, that in the 2 weeks prior to a fetal death, there may be changes in a baby's movement that we could identify, or the mom could identify and speak up. So I think there is opportunity there. So there have been several studies, and this was one of the studies that really helped to spur off Count the Kicks. Patients were educated on getting to know what's normal for their baby and to speak up if they notice a change in their baby's movement. And Norway saw a 30% reduction in stillbirth by doing this. So this is kind of some of the evidence that pushed Count the Kicks to come to life in the US. These are just some QR codes, and we can put the links in the chat or get them to you at the end. You should also have this presentation in a PDF, I believe, so you can have these QR codes that you can scan. But this is just some more evidence around Count the Kicks and how parents who utilize Count the Kicks have improved outcomes. So Count the Kicks, started in what's the exact year, Megan? I was going to say the early 2000s, but what's the exact year that
Count the Kicks was created in 2008 and the nonprofit was created in 2009. Healthy birthday.
Okay, so this graph is very interesting. This is showing you Iowa's stillbirth rate, which is the blue teal colored dots. The red line is the stillbirth rate in the US. And so you can see that Iowa's stillbirth rate has been declining over time, while the US's stillbirth rate has remained relatively stagnant. We've seen some decrease there in 2020, 2020. But Iowa has been steadily declining, and especially after they began this implementation in 2008, 2009. And so it's hard to say that it was only associated with Count the Kicks, but that's the only known intervention that was going on specific to stillbirth in the state. It was widespread. It was a public health campaign. Everyone was engaged. And so it's very challenging from a research perspective to correlate those two things, but it's known that that was the only initiative that was going on at that time.
And that's what I just put in the chat too with the evidence. That was one of the QR codes, that BJOG study. That's what Dr. Alexander Hiesel, who's a prominent, well-known international stillbirth researcher. He studied that reduction in Iowa compared to other states that didn't have Count the Kicks or stillbirth prevention programs like that. So that's what that study references. That's what we want to bring to Maryland. Even more. We want more than a 32%, right?
That's right. In addition, AWAN recently, if you're all not aware of this, AWAN recently issued a practice brief addressing decreased fetal movement, and it outlines some critical things that nurses need to be doing when patients present with decreased fetal movement. And a key component of this aligns seamlessly with Count the Kicks. So if you're unaware or haven't read this, we definitely recommend taking a read. You can access it via this QR code and definitely share it with nurses on your floor, because it focuses on assessment and management of decreased fetal movement or significant changes in fetal movement patterns by perinatal clinicians to improve fetal outcomes. So Count the Kicks aligns with being able to carry out this A1 practice brief.
Can I add something, Adrienne?
Sure, please.
Sorry. And this is how Adrienne and I will go throughout the presentation today. So going back to the A1 practice brief, we at Healthy Birthday have worked with A1 National for about 2 years on a research project around what to do when somebody comes in to your unit or clinic with reduced fetal movement or a change in fetal movement. And so they have done this lit review, and that's part of the practice brief. But in the next 2 months, probably early next year, they will release their journal article on it, as well as a pathway that they created based on the research that they found. I got it. And that pathway will be live and everything like that you can access through the A1 website. But it's really cool because we piloted that algorithm pathway throughout the US in 9 locations. So I'm really excited that we were a part of that and that we are able to create the standardization and systemic change that's going to impact everybody across the United States. So be on the lookout for that for any of you A1 nurses on. And even if you're not an A1 nurse, you can still access it when it comes out. And I'm sure Adrienne will share it far and wide. So just wanted to add that.
So this article is an article that Megan, myself, and Sarah Coleman, the state expansion director at Healthy Birthday, wrote. And it's really just kind of summarizing a lot of what we just shared, and really encouraging nurses to ensure that pregnant women receive standardized education about fetal movement counting and to know their baby's normal movement patterns. And this is free and open access. So another resource you can share with your team as you're, kicking off this implementation so that they feel like they really understand why. I feel like when you're implementing something, the key part of it is for people to really understand why we're doing it. That is not just another thing that we're doing to check the box, because they're already being bombarded with so many different things that they're trying to implement. A new thing is always coming, but recognizing that this is just strengthening something that we were already doing. How do we strengthen what we were how we were teaching patients about fetal movement monitoring? And I found that there's a lot of opportunity there, and we're going to get into that in a minute. So, I try to think through what are some of the barriers, what are professional organizations saying about fetal movement counting, because I think that's at the heart of what we need to be able to speak to. So we just showed you what A1 is saying. A1 is saying this is a priority. This is something we need to think about. This is what we should be doing around decreased fetal movement. And that is, really getting to assessing patients and providing them tools to be empowered to speak on those things. So ACOG doesn't have specific recommendations on fetal movement counting. Here's what they state. So they state that the best practices in fetal movement counting include encouraging patients to be aware of fetal movement patterns. Providers should be attentive to the complaint of reduced fetal movements. They should address reports of decreased fetal movements in a systematic way and use shared decision-making to employ intervention safely. So to me, that lines exactly with what Count the Kicks as a tool, as a patient advocacy tool does. And so I feel like it aligns directly with ACOG as well as A1. So this is, just a little bit more about what ACOG states, that interventions on fetal movement counting have been implemented differently in research. So sometimes the feedback that I get, I think Megan gets, and maybe some of you have gotten from some of our provider colleagues, especially because of the current research on fetal movement counting, is that research doesn't support fetal movement counting. But here is why. ACOG states that interventions on fetal movement counting have been implemented differently in research, making it challenging to synthesize the results. Standardization in how we teach patients about fetal movement counting is needed in research and practice for us to see improvement. So that's what Count the Kicks really does. Research also requires fidelity in the intervention to draw adequate conclusions. So patient interventions need to be standardized in order for us to see improvements. And that's really what Count the Kicks does and where it comes in. As I mentioned earlier in the presentation, there has been several meta-analyses, which is like the highest level of research, looking at do we see improvements in outcomes, meaning do we see decreases in stillbirth when we use fetal movement counting. And, the research hasn't been successful in showing that. However, all of the studies implement fetal movement counting differently. Some with the written instructions, some just teaching, teaching people verbally about it, some telling them to lie down and drink a drink, and all different instructions. So when we were doing this work and starting to like dig in about the research on fetal movement counting, one of the things that we noticed was that patients report that as a problem, or they report that as a concern. They don't know what to do when they receive different instructions on how to monitor their baby's movement from different people. So the provider might say one thing, the nurse might say another thing, give varying instructions. And so then they don't know, should they follow up? Should they not? Maybe they should just wait a little bit longer. So what we're hoping by the end of today's presentation is we can get everybody on the same page and just be talking about it using one standardized instruction, Count the Kicks, one standardized tool, and encouraging patients to follow up. And hopefully that's what you'll take away from this through the implementation, that we just need, just like any good quality improvement initiative, it needs to be standardized. Variation is the enemy to quality. If we're not all standardized in the way that we're implementing something, we are not going to reach our desired outcome. And in this case, that is to prevent stillbirth. So, there are different studies which we have linked in the PowerPoint that you can refer to, and we definitely recommend you refer to these. In this study by Hayes and colleagues, they did not see an increase in hospital utilization, which is something that we hear a lot, that there's concerns about. If we're talking about fetal movement monitoring, there may be an increase in coming to the hospital or utilizing the hospital. And in this study, they said encouraging awareness of fetal movement may be associated with reduced adverse neonatal outcomes without an increase in interventions in labor. So that would definitely be a study to read more and to dig into. I think with Count the Kicks, the kind of hallmark of Count the Kicks is that we are telling patients to pay attention to their baby and to pay attention to what's normal for their baby. We're not comparing them, we're not having them compare it to any standard. So if their baby is, not typically, super movie at a certain time, then they'll be used to that. They'll know that's normal for them. So I think that's a little bit different than some other fetal movement instructions that we give. We're looking for them to just pay attention and advocate for what's normal for their baby. So this is kind of highlighting what we shared before, that more than 15% of maternal deaths within 15 days of delivery occur in women who experience a stillbirth. So we want to prevent stillbirth. Two, we want to make sure that in patients that experience a stillbirth, that we are being really, really thoughtful, that we are providing those same type of discharge instructions around urgent maternal warning signs, when to follow up, because they are at increased risk of maternal death and morbidity as well. So, again, um, I think we kind of we talked about some of these things, but making sure that we are that when we're noticing changes in fetal movement, that it could also be signaling complications that could actually threaten the mother's life. So, when we talked about that, placental insufficiency is what drives fetal movement because of the acute or chronic hypoxemia. Some of that placental insufficiency could be associated with something, for instance, like preeclampsia. Maybe the patient has had increasing blood pressures that hadn't previously been picked up. And so when the patient arrives due to decreased fetal movement, we find that she had elevated blood pressures. So there could be, it could be signaling something else that we need to be paying attention to. So this is my favorite slide, I'm going to say, because this makes it to me feel very, very obvious why we need to all be implementing Count the Kicks. But and I would love to hear your feedback on this, but we all should be talking about the urgent maternal warning signs. I don't think any of us have any would disagree. I think we're all probably on the same page that we may all be providing this exact same handout to our patients and talking about them. Baby's movement stopping or slowing is on the urgent maternal warning signs handout. This is what's listed by AIM. This is what's listed by CDC. So it seems to me that providing the patient a tool to monitor baby's movements is no different than us giving the patient a blood pressure cuff to monitor their blood pressure to see if there's, or telling them to come in if they're having, increased vaginal bleeding. Like it all to me feels like it aligns. So that to me was like a huge like light bulb moment when I started thinking about how Count the Kicks aligns with the urgent maternal warning signs. So, Count the Kicks is a highly effective evidence-based stillbirth prevention program. It started in Iowa, as I mentioned. It is developed a proven early warning system for moms and has saved lives in 36 states and 5 countries so far. So, Megan, do you want to set this up a little bit before I hit play?
Yeah, thanks, Adrienne. That was great. So if you didn't catch early on, my name is Megan Ake. I am the program director with Healthy Birthday, which is the nonprofit organization that we've talked about, Count the Kicks, that created Count the Kicks. So I'm going to go into a little bit more about what Count the Kicks is, how to have the conversation with your patients, and the importance of it, and how to use the app and some of our other tools. And then we'll move forward on the implementation. So if you recall, just a couple minutes ago, Adrienne was talking about how this is a public health crisis and the importance of public health programs like Back to Sleep and Count the Kicks. And I just had this video, this just aired, Gianna's baby safe story on social media, gosh, a couple weeks ago, and went viral. The power of social media, right? We all know that there's power behind it, but we want to make sure we have credible resources. And there's pieces out there like our channel and Marland Patient Safety channel that we highly encourage you to use and share because those are credible. I'll talk a little bit more about that as we move forward. But this is one of our what we call our baby safe stories or a success story. So somebody was using our app, they were told about Count the Kicks by a nurse, or they saw a sign, or they saw it on social media. They started using the app. They noticed a change in fetal movement. They spoke up to their provider, and now their baby's here and they're safe and sound because of it. So I just wanted to share her story to kind of set the stage leading into the app conversation. So go ahead and hit play, Adrienne. So her story is really interesting because if you saw that, sometimes it's hard to read the font, but she had headaches going in several times. And I think that going back to what Adrian was saying about identifying other risk factors like preeclampsia, she's a perfect example of this. So thankful that Gianna's here, that she's here, and everybody's safe and sound. Go ahead and go to the next slide.
Oh, well, okay.
I'm just gonna keep watching it on YouTube. That's fine. There's a lot.
Apparently,
We have a YouTube channel, so feel free to check that
apparently
out.
we're going to. Hold on one second, guys. Apparently they're gonna have a little tech issue here.
No worries. So while we wait, I just put in the chat if you've heard about Count the Kicks? I'm assuming you have, but I just want to know yes or no if you've heard about Count the Kicks, and then we can kind of go from there in a minute.
What are you seeing now, Megan?
YouTube.
Okay, we're gonna try something else here. I'm gonna try sharing screen too because screen one is not.
Yeah, there you go.
No, what are you seeing? Are you seeing the notes too?
Yep.
What?
Yeah, I'm
No?
seeing your notes.
Hmm.
But you just need to change the presenter too.
Yeah, it's blocking everything.
Oh,
Let's
there you
see.
go.
Sorry. Can you see now?
Yeah, that's perfect. So
Okay, let me go forward.
So a lot of you have heard of Count the Kicks. So we're going to talk about a little bit more. Maybe you walk away learning. Just get forward.
It's not liking me. It's not liking me to get past the video.
Just try your arrow on your keyboard. Try one more. There you go. Okay,
Can you
we
still
got
see
it.
it?
Yeah, we're good. We're good.
Okay, perfect.
So we're going to talk about how to count the kicks. And hopefully if you've heard about it, you walk away knowing more information, or if you've never heard about it, this inspires you to download the app while we're talking and make sure that you're talking about it with your patients. So go ahead and go to the next slide. So this is kind of a step-by-step guide of how you would want to educate your patients when you're talking about Count the Kicks and fetal movement monitoring. So this is a really nice digital tool that we have available on our website in multiple languages, but this is exactly how you walk them through the process. We're going to say, starting in the third trimester, you're 28 weeks, that's great. I want you to start tracking your baby's movements. There's a free app for that. Let's download it right now. Here's a brochure. So you can hand them the pamphlet that you order on the website, thanks to the Maryland Patient Safety Center. Or if they don't have a smartphone or they don't want to download the app right then and there, there's also paper kick counting charts that they want to do a little bit of old school, pen and paper. So you're going to encourage them and say, I want you to count your baby's movements every day in the third trimester around the same time. So pick a time that works best for you or when your baby's most active. Maybe it's 5 o'clock in the afternoon, right before you get everything ready for dinner. Maybe it's 11 o'clock at night as you're winding down finally and you're in bed. Whatever time of day, try to do it around the same time each day, because what's really important is getting to know what's normal for your baby. And the way to do that is tracking around the same time each day. So what you're going to do is you're going to time how long it takes your baby to get to 10 movements. Using the app, it helps you track that by tapping a footprint on the screen, which I'll show you in a minute, and a timer. And then if you're not using the app and you're just using pen and paper or the paper kick counting charts, make sure you use a timer, whether on your phone or a clock or something like that. So you're going to time how long it takes to get to 10 movements. You're going to explain to your patient what a movement is. Some people get confused because we're called Count the Kicks, but it's more than a kick, right? It's a jab, it's a push, it's a roll, anything except hiccups. Hiccups are involuntary, so they don't count towards the movement. And then you're going to say, after a couple of sessions, you will start to see a pattern. You are going to get to know what's normal for your baby in terms of movement. And that's what you're going to pay attention to. So if that ever changes or you feel like it changes significantly, you're going to give me a call. You're going to go straight into the ED if we're not open. I want to hear from you because I'm here for you. Go ahead and go to the next slide. So this is our Hallmark tool. This is our evidence-based Count the Kicks app. This is a really great, useful tool for those parents that are tech savvy and have smart devices and want to download the app. It's completely free. There are no ads. There is a daily educational notification after a session. That's something we control. It's no advertisements or anything like that. It's currently in 21 languages. And how it works is you see that big red start counting. Once you tap that, there will be a screen with a big footprint. and you tap that footprint, and every time you tap it, there's a timer that starts. You tap it every time you feel baby move. So after you get to 10 movements, the timer stops automatically, so you don't have to worry about that. And then the app will ask you to rate the strength of those movements, because research also says you should be paying attention to the strength of those movements as well as how long it takes to get to 10 movements. And then you can add notes. And then what's really cool is you get a graph. So like what you see there on the screen, that pink and red, yep, right there where she's pointing with her cursor, you get a graph. So after a couple of sessions, you as the app user get to see, okay, my baby takes around 15 minutes to get to 10 movements. I know that's my baby's normal. That's been my baby's normal for the last 2 weeks. And I know that's important. So maybe if one day I'm counting and all of a sudden it took an hour and 15 minutes, the graph would change. So that would be up to the app user to say, I should call my provider. And they're going to be educated on when to call you and when to speak up if they feel like it's a significant change. I get asked a lot if there is like an alarm limit on this. And so I just want to address that head on. There's no alarm limits on this. So if the graph changes and the app user feels like that's not my baby's normal, think of this as more of like a data download of mom's intuition or the parent's intuition, that they can then go to their provider and see, look, this is not my baby's normal. Think of Gianna's mom, where she said, look, my baby is not moving like normal, and now I'm having headaches. Like, I need to be seen. So it gives them an additional way to feel empowered to speak up to their provider if they notice a change. Why aren't there alarm limits on this? Because there's been no research around standard deviation of what would be significant or not be significant. So with the Cardiff method, what we're doing is just giving them those tools and resources to feel comfortable getting to know what's normal for their baby, and then speaking up if they notice a change. You can set daily reminders on the app as well, so they don't have to go back out to their calendar and set that. I would highly recommend that you walk through this with them at that 28-week appointment. I know my 28-week appointments, always I had to take that terrible drink gestational diabetes test. I'm assuming you all do that there in Maryland, and it's required potentially. And in Iowa, we always had to take it like in the clinic where we're like being watched like by the nurse, and then you get your blood drawn. So if that's the case, what a perfect opportunity to say, great, you took that awesome drink, sit down, wait for your next blood draw. Here's a brochure on Count the Kicks, download the app while you're waiting here, and then let's talk about it. This should take 3 to 5 minutes, if that, when you're having this conversation about the app. And then you're going to say, I want to see your data. Share it with me next time you come in, put it in your My Chart, that type of thing. So again, this is completely free. That cut off at the bottom, but it says we don't share our seller information. We only use it for research purposes, and people are asked that on the app if they're okay with their data being used for research. So they have that option to say no as well. So that's kind of the basis of the app originally. So if you go to the next slide, I want to talk about, this is my favorite slide. Adrienne has her favorite slide. This is probably my favorite slide right now because I'm super excited to share a new feature of the app. So if you have been using the app, and I highly recommend you all take a few moments to download it, if you haven't already, is go into your app store and download it. I know we can all multitask. Once you download it, we have released just in the last 2 months an Ask Anna AI assistant. So Ask Anna is a free tool where people can go in on the app. They just click that little icon there that you see that arrow pointing to, and they can ask any sort of fetal movement monitoring question, fetal health, maternal health, and Ask Anna provides evidence-based answers. So remember early on when I talked about the importance of having credible things out there in the world and the internet and the World Wide Web? Ask Anna is available on our website, on our social media tools, as our channels, as well as the app. So what happens is Ask Anna is curating answers from research and evidence that I've curated with some of the medical advisory board members. And you can see it on our webpage about Ask Anna. So she is not giving answers from Google or TikTok or anything like that. It is completely evidence-based. And what's really cool is with each answer, she has a citation, so people can go and look at what those are. The other really cool thing about Ask Anna is the fact that in the last, let's see, we launched this in September 22nd. So it's been almost 2 months, and we've had over 2,000 people ask questions and ask Anna response. So what I can do is I can go in and look at what people are asking, how Anna is responding for quality improvement, quality control, and then I can come up with what are these common themes. And I can tell you just anecdotally, some of the common themes are really just in general, how to track movement and what is a movement. So make sure you're having those conversations with your patients. Hiccups are asked a lot. That seems to be a common question. And then some other questions that we'll get to are things like, my provider told me to drink juice. What should I do? So we're going to talk about that here in a little bit about some of those misconceptions. But currently, Ask Anna is available in those languages, and it is completely free. So I wanted to make sure I shared that new feature with you all.
Ready for the next slide?
Yeah, sorry. Another cool feature that we have on the app, if you aren't aware, is we have a place where people can search for free and reduced cost resources near them through just entering their zip code. And then maybe they're looking for food assistance or diaper banks. They can search for that. And this Find Help resource will help them get access to that and give them the address and the location and everything like that and the time. So I just wanted to highlight that's also on our app because we know, go ahead and go to the next slide. We have a very captive audience, if you will, right? We have thousands of app users every single month. We average around 11 to 12,000 app users now around a month. We've had over 400,000 registrations. We have 6 million pieces of data with this app. So we have a lot of research and data there. We know that we have people that need resources. And so if we can connect them to resources prenatally, do we also have a chance of impacting potential ACEs, right? The chance of that baby experiencing adverse childhood experiences is our goal, right? To reduce those. So on top of that, we've done some research on our app through Des Moines University and the Harkin Institute and found that 84% of app users stated that regular tracking was associated with feelings of bonding. And 77% of app users reported feeling less anxious because if you think about it, now you have a highly educated individual that understands what's normal for their baby and can speak up to their provider if they notice a change because now there's data in their hands or there's the paper copy, whatever. They feel comfortable also because you've talked about it. You have said, I want you to do this. We've done studies and looked at studies and surveyed our app users where we ask, what is the number one reason why you would come in? And they'd say, because my provider told me to, because my provider talked to me about this. Like, you are so important to the health of their mental and physical health that having just a 3 to 5 minute conversation is so, so important. I also get asked quite a bit about significant others and bonding and how can partners be involved. This is where bonding also comes in too. So partners can be involved. They can log into the same account and see the data and they can sit down and say, let's count. It's time to count. I got the notification, or, hey, let's read a story to your little brother or sister, to a sibling. So I think that's where the bonding comes in quite a bit too, not to mention literacy and things like that. So go ahead and go to the next slide. All right, so Adrienne did a really good job at promoting this event and sharing how to access materials. And so it's really due to this wonderful partnership that we've had with the Maryland Patient Safety Center for, I don't know, two years, or seems like forever I've known Adrienne, that you can get all the materials for free. And that, what I mean by that is the patient education materials, the brochures, the posters, the app reminder cards, like you see here. Adrienne also put it in her email. I'll put it in the chat later. But why wouldn't you take advantage of this, right? It's completely free. And this is going to be your tool, your talking point to start this conversation. I know how hard it is to talk about this tragedy. You know how hard it is to talk about stillbirth. But we have to remember, we talk to people all the time about risk factors. We talk about the importance of folic acid and not drinking and all the blood tests that we can do. This is another thing that we need to be talking to our parents about so they're educated and know what to expect and how to speak up. So scan the QR code, go to countthekicks.org, click on order materials. All of this is free and it's really going to be one of the stepping stones in your implementation that Adrienne will go into here in a minute. Go ahead and go to the next slide. So let's talk about some common misconceptions, and feel free to put them in the chat too if you've heard of anything that you want us to address. I know Adrian's a wealth of knowledge in this area too, so she can answer. But one of the most common things or questions I get, and in fact, I just had this asked from a health system in Nebraska, where they said, our doctors, we still have in our standard of care is 10 and 2, that we want to tell patients to count and make sure they get 10 kicks in 2 hours, or 10 and 1, I hear quite a bit. And so our response is that that's outdated. Oh, we've got some weird, there you go. Outdated, because what we really want to see, and there's research on our evidence page around this, is how 10 and 2, Adrian kind of mentioned this earlier, when we get so set on a time, we focus on that time, right? So let's say I've been counting, and I have been counting around the same time each day. I get 10 movements in around 15 minutes. And one day I'm counting and I got 10 movements in an hour and 45 minutes. But I think to myself, well, I still got 10 movements in 2 hours. I'm totally fine. That's a change, right? Like, you'd want to be notified if that was your patient. But in her mind, this is why communication and words matter. She heard 10 and 2. So no matter what, she knew she got 10 movements in 2 hours. She's totally fine. But really, she should probably get checked out, because she actually has been getting, for the last 2 weeks, 10 movements in 15 minutes, 15, 20 minutes. So that's where we struggle with that time a little bit more. And that's what the research that you'll read on our website about, is that 10 and 2. We just don't want to put that time limit on it. We don't want to compare to other pregnancies. We don't want to compare to our friends. Go ahead.
I was going to add that I do not believe, I could not find it, that there is any research to support that 10 in 2 hours, like that you had to achieve 10 in 2 hours, or else it was an okay outcome versus it was a bad outcome. That's where this all comes from. So that's why the count the kicks one is just saying what's normal for your baby.
Right.
I would say that if this is what you've kind of been teaching from, that what's the research to support this method. Whereas if providers are asking, we're not just telling patients necessarily that they need to have any prescriptive amount of movements. We're just saying, like, what is normal? What is normal for your baby, and start to establish that and pay attention. And to me, that just feels like advocating for our patient. And so it's similar to me, like, I think of things like prenatal care, and how we have decided the number of prenatal care visits that we need. That was also arbitrary. And now we're revisiting that, related to, now we have virtual visits and all kinds of different things we did during COVID. So a lot of the old kind of ideas that we had around prenatal care and prenatal education wasn't necessarily built off of research and evidence. So the 10 kicks in a 2 hours, because sometimes you'll see people give different amounts of times. It has been just around for a long time, and there wasn't necessarily evidence around that.
Right.
Jennifer asked, what's the minimum time frame to indicate a significant change or concern? I felt 10 movements in an hour yesterday and the day before, but today it was 1 hour and 20. So when should moms feel concerned with the difference? I think that's the hard part about this, Jennifer, and I'll see what Megan answer is. And that's where I think the conversation should happen with providers. If the patient is noticing a difference and it's different than it was, we don't have statistical evidence to say when it's 10 an hour and 20 one day and an hour the other day that there's a problem. But we definitely would say that if the mom is feeling like there has been a difference, and her trend, that's where that trend line comes in, like over time, you will start to see that trend within the app that will show when there has been differences. Like maybe one day she is an hour and the next day she's an hour 20 and the next day she's an hour 15, like that's her range. Then maybe she's not going to feel like it's something different. But if she's been consistently 45 minutes, 45 minutes, 50 minutes, 50 minutes, and then one day it takes her an hour and 20, then maybe that is something for her to say, hey, I want to call the provider and have a conversation about where to go next.
Right.
Megan, what would you say?
Yeah, I would say the same. I think it goes back to what they perceive as normal for them, and knowing that they can call you at any time, I think is really important. Now I'm gonna get like, oh, well, we don't want a bunch of calls to our nurse line and things like that. But what will happen, and I guarantee that won't happen because I've been doing this for so many years and get all this feedback and stuff. And we always think worst case scenario, right? Like that's what's going to happen. I'm going to have all these C-sections. I'm going to have all these calls. That doesn't happen. But with this part of it is you now have an educated individual that's like, I do feel like something's off, right? Like I can see it here. I also want to call and be seen. And 9 times out of 10, they come in and everything checks out great and everything's fine. But we want to make sure you catch that one time, right? You also have to take into, and I know I do not have a medical background, but taking into account any other risk factors that they might have or travel time. And that's where the A1 practice brief also comes in. It addresses some of those pieces that I can't as a non-medical provider for you to think about. That's also what the pathway that I talked about will also address and walk you through too. So
And I think I think this is the question that I would love to eventually answer. The challenge about like what is the significant what is a significant
yeah.
difference? But right now there hasn't been any outside of Count the Kicks. We don't have this standardized implementation around education or way that we've been able to measure this. So I think it's really just about patient advocacy, providing them with information that a decrease in fetal movement does or can signal changes that are going on related to the baby's health or the mom's health, and empowering them and supporting them to speak up. Because we know that with lots of other things where we haven't necessarily done that, just like with Gianna's story, that we've done a disservice to our patients. So
Yeah. Um, I was going to add something else too. Oh, as part of, going back to the standardization, one thing that we'd like to research and looking for funding and things like that is adding AI into our app in terms of looking at kick sessions and outcomes to potentially identify risk factors before they're diagnosed, like preeclampsia, which will we ever come and say like, here's a standard deviation? We would need tons of studies for that, but it's similar to like how you would do blood pressure, right? Like, here's your range, like, here's this, we want you to be seen if it's X, Y, and Z. So we are looking for potential research projects around that would fund that type of study. Cause like I said, we have 6 million pieces of data around that could help, be very innovative and help this process. So go ahead.
we go next slide.
Yeah.
Okay.
So another common misconception I get quite a bit when I do like hospital implementation and talk to providers and is something like, well, it's, we just tell them to drink Mountain Dew or have a Snickers bar. Or I've heard jumping jacks, or we talked to somebody in Mississippi who was told to put ice on her belly to get baby to move. And so again, alongside the A1 practice brief, what we want to remember is we want to be monitoring movements without interventions. It's just like when you and I are sick, we're laying down on the couch, we're conserving energy. We're not chugging a bunch of energy drinks and things like that. We're conserving our energy. And that's the same with baby in utero. If something's going on, they're not moving as much, whether that's infection, low amniotic fluid, cord issues, whatever. Something with the mom, they're conserving that energy. So why are we trying to force baby to move if they're not moving like normal? Does that make sense?
Megan, do you have I know they were in a different slide set, but I'm realizing it's not linked on here. Do you have the research related to this linked at the end of this presentation?
It'd be on our evidence page. So I linked that quite a bit.
Okay.
Research on there around that.
Yeah, just to make sure that they have the articles, because I'm sure that they may get some questions around some of these things, and we can send you. I think the research page is linked in. I know the research page is linked in the implementation toolkit, but if you want us to pull up and send you directly the links that are associated with each of these misconceptions, we can definitely forward that because I know that was on a different slide, but now I'm just seeing it's not there.
I have a lot of, I'll also send Adrian to send out to you guys, this really nice document that goes through more of those misconceptions, and the sources are cited in the PDF. So that's just kind of a standalone piece. I'll send that to you, Adrian, to send. It's called
Perfect.
like talking points essentially, but I'll share that with everybody.
Okay.
All right, so I asked you earlier who's heard about Count the Kicks. Now my question is, how many have ordered the materials either right now as I was talking, because you're awesome at multitasking, or during the email that Adrian sent, or before? I don't know if
You
you
want me
actually
to
did
put
a,
that in the chat? In the chat. Okay.
yeah, I didn't know if you did a poll or we just want to talk about it. Or
You
did
just put it in the chat. Yes, you ordered or still need to order.
we ordered,
Yay.
we ordered. So I think the next question is really good for anybody that's maybe ordered and tried to start implementing this. I'm looking at you, Katie. What barriers or any barriers or assumptions do you think you'll encounter during implementation? Because now we're going to go into the full implementation of what this is, but just wondering if you have any concerns leading into that, or if you've already broached this with your stakeholders and kind of gotten pushback already that you're hoping to be addressed in this, and that's why you're here.
Or there was no pushback
Come
at all.
here,
And
no
everybody was just
pushback.
like, we love it. We want to give it to everyone. It's the best thing ever.
Happens.
That we love.
Usually the majority, but every once in a while we get one or two folks that say, well, so-and-so said this, and now I have to go back and do all these things. So you can raise your hand. We can put you, you can go off mute if you'd like to do that versus typing. It's up to you. Yeah,
Hey, Kathy.
that's awesome.
I think, we're definitely at this point, I would say, Megan, and all of you on the call, please chime in if you think I'm incorrect. So we have been socializing this for a while now, and I'll kind of also share what my master plan was behind this. And so my thought was, first, I wanted to make sure that we just had this widespread awareness of the materials. And I will tell you that I believe that that has occurred. We have we're at like maybe 68,000 pieces of material. 68,000 pieces of educational materials have been ordered since we started this. And we might even be higher, since then. I think that was about 2 or 3 months ago. So we got the materials out there. So then the next thing I've been tracking is app downloads. And so I will tell you that I'm going to talk about app downloads today because I really would love all of your help in continuing to push the app downloads, because to me, this is the way I've been thinking about it. The patient education materials are great. I wanted to get them out there. That means when I see these orders increase exponentially, we're at about 70 or 80% of hospitals and about 80% of health departments. And that's what I had used as my kind of denominator to spread implementation. I use that because the first thing I wanted to say, okay, when I watch these materials increase, did it get to you all? So if I see the orders increase and I'm tracking the number of birthing hospitals and the number of health departments that have ordered, then I know the materials got to you. To me, the app downloads are my way of kind of proxy measuring that the materials got to the patient. And so we have seen a significant increase in our app downloads. When we started, we saw about 30 before we did our like kind of widespread ordering of materials and outreach and that kind of thing. We saw about 30 downloads a month. We're up to about, I'm going to say on average, about 250 downloads a month. So great improvement. I would love to see us beat every other state around in terms of the number of app downloads. I feel like that's kind of our way of proxy measuring that the education got to the patient. I know not all patients want an app or even can have an app, and that's fine. But I do think we still have room for improvement in terms of getting the app to folks. So with the app, in order for us to measure that as as kind of attaching to Maryland, they have to actually not just download, but register. When they register, they put in the zip code, and that's how that's being monitored by Megan and her team. She's able to say there's been X number of app downloads within our state. So so as we talk about implementation, really the app downloads are not necessary in any way, not required, but it's just a way for us to track how well this is spreading across the state to the patient.
And I'll just add our ultimate, I mean, factor is a decrease in the fetal death rate, right?
Yeah.
I mean, that's the problem with data, as I'm sure you all know, is it's so far behind. I mean, the fetal death rate is about 2 years behind, but you in health systems, one thing you could do is you could pull your own data around how many people you're seeing with one change in fetal movement and then what that process looks like for you, but then also how many stillbirths you as a center are seeing. And so that could be your baseline essentially. And hopefully, as you implement this throughout the clinic system, you start to see a decrease in those stillbirths. I know people can come from all over and deliver. So I know some people won't always have that information, but it could be another way you could look at some of the data.
Yes, I definitely agree. Like long term, that is what we hope to be able to look at as the outcome. So this is kind of the step-by-step process. And that's why I wanted to have this conversation today, because as a, quality and safety person, to me, we can give education, we can hand them brochures, we can give them apps, but if we haven't really put a lot of structure around how we're educating, when we're educating, how often we're educating, and how we're telling people to follow up, then we could still have variation in our system. Judging by the fact, if we were all to go back and talk to our teams about how they talk about fetal movement monitoring, do we think there would be 100% consistency in how they do that? So just like with other quality and safety things in the maternal health space, we want to see consistency. Like think about time to treatment for hypertension. We want to see a blood pressure reassessed in 15 minutes. We want to see a patient treated within 30 to 60. With this, we want to see patients being educated, starting in the third trimester and being reminded every single visit after that. And we want standard education talking about how to monitor the movements the same way, because that variation results in confusion. And, the one thing I didn't mention before that really also was very powerful for me, across the state, there are several different femur, and that's fetal infant mortality review. And as part of that work, they do interviews with patients that experienced loss. And when I would hear these cases, they would talk pretty consistently about that they noticed that the baby started to move less, but they didn't really, they thought it will just become more. I'll just wait till the next day, or I'll wait, till Monday when my provider's back in the office, and I'll follow up then. Or they would say they didn't know what to do. They didn't want to go to the hospital because that just seemed, like a lot or dramatic, and they didn't want to bother anyone. They're sure it would just, it would just come back. And so I heard that pretty consistently. And then some of the femurs that, I had heard them say that the count the kicks or a standardized way education around fetal movement monitoring was something that they had bubbled up as a recommendation. So that was how Maryland Patient Safety Center got involved, through recommendations that came out of femur reviews about fetal movement monitoring being, a really important recommendation to impact stillbirth, and then understanding that there are significant disparities in this outcome across the state, that we need to make sure that we're getting this education to everyone, and that Count the Kicks had these resources in many languages. We did fund the translation for Haitian Creole so that we would have those, because that came from you all as something that was needed. So yeah, I see that Jennifer said that wished AI was in Haitian Creole. I think I see that as a definite need across many areas. So So that's kind of how we got involved and where we are now, and why I wanted to call this meeting around the implementation toolkit and standard work. So you all should have received um, two different standard work documents. I gave them to you in Word so that you could edit them to meet your needs. And then you got the PDF of today's presentation so that you can go back and have conversations with your team and discussions around it. I had encouraged you to download the app, and that's really just so that you feel really comfortable with it. So when you're educating your team, you feel comfortable with talking through how to use the app. And then I gave you the implementation toolkit. So I'm going to stop sharing for a minute and just pull that up. 1 second. So while I'm pulling that up, has anything we said been surprising, shocking, interesting, something that you didn't know before and are like, huh, that was new to me. Good refresher.
Well, this part's going to be new too, because I haven't said that.
This
Misconception.
is gonna be new. Okay, let's see if I can actually share and you can see it. Okay. Let me know. Can you see the right screen, Megan?
Yes, it's the guide. You just have this, yeah, this weird black box around it, but
A
there, that's
weird.
better.
Is it okay now?
Yeah, it's fine.
Okay. So you all received the toolkit, and this was something that Megan and I put together. So you are all the
The
first
first one.
getting
Woo!
you're the first ones getting to see this. So we love feedback on it. So please, as you have an opportunity to look through it, please feel free to email myself or Megan our contact information. You all, I think, know my contact information. Megan's contact information is at the end of the toolkit. Please let us know what you think or what you think needs to be added, because this was our first try at this. And it really is because I am so passionate about implementation science and think that this has everything to do with our ability to actually see our desired outcome. So the first part of the toolkit, really from the page 6 down to page 14, is stuff that we went over at the beginning of this presentation. So this is the history, the background, all of that information that we shared in our presentation that you need to feel really comfortable with as the site champion to be able to take this back. You can use the PowerPoint that we gave you in PDF to kind of show some of that information. You can refer to this toolkit, whatever works for you, to give that background information to your team. So for the rest of the time today, I'm really going to focus on this steps to implementation portion of the toolkit so that we can kind of dig into this nitty gritty. I hope that you will ask questions and really engage in this, because I want your feedback on where you think this might be challenging. So as I mentioned, I think that at the heart of all of this is that we need to ensure a standardized implementation to Count the Kicks. It can't just be brochures. I'm sure all of you have done patient education on other topics, and you order some brochures, you put them on a shelf. After maybe a bit of time, they're not used anymore. You might just be shoving them in a bag or in a folder, or just say you should monitor fetal movement and putting it in there, or review this. We probably aren't going to, achieve our goal if we're implementing it that way. So how can we realistically implement this, understanding that we have 10,000 different topics that we're trying to implement, discuss with our patients, implement this in a way that gets our desired outcome, which is to reduce rates of preventable stillbirth and eliminate disparities in the outcome. So that was our aim. And the objective of this toolkit is to ensure that all birthing people are educated about fetal movement counting. So we have seen in the research and in talking to people that sometimes at different places, they talk about fetal movement monitoring to only certain patients with certain risk factors. So maybe patients who had a history of stillbirth, they'll talk about it. Maybe to patients who are getting NSTs, they will talk about it. But even among them, the instructions vary. So we want to get to the point where we're talking about fetal movement counting to everyone, and how we talk about it is the same. So how do we work on this? So it sounds like most of you, if not all of you, have already ordered the materials. So great, check. On this preparing for implementation, we want someone to be the Count the Kicks champion. So I'm going to anoint all of you Count the Kicks champions today because you took time out of your very busy day to come to this. You need to be a cheerleader of sorts. You need to feel passionate about this work, dedicated to the cause, dedicated to stillbirth prevention, because your excitement and your passion will be contagious. It will spread. You'll bring other people along and get them to see how important this work is. And so dedicating a Count the Kicks champion, if it's not you, maybe someone else on your team who also feels really excited about being able to dig into this work and passionate about the topic. So if it's we recommend that folks take some additional education to feel comfortable about advocating and educating others on this. There is a CU CME Standardizing Care for Healthy Beginnings, a healthcare professional's guide to conversations with expectant parents. There's 4 CUs. It does have a cost associated with it, though. So we just wanted to make you aware of this, because we would recommend that whoever is going to be your Count the Kicks champion really have a thorough understanding of this work, why we do it. And this is available on the Count the Kicks website, and it's linked here. We can also encourage them to refer to this recording as well to learn more. And we want them to review the Count the Kicks website as well as all the research, because they need to be able to speak to the myths. They need to be able to speak to the barriers. It is perfectly normal. And actually, we encourage, providers, nurses to have questions and to dig in about this. We need to, because we want to do the best for the patients. And those questions will help us to just continue to grow and get better in this space. So reviewing the website, reviewing the research, and really feeling like you are an expert on fetal movement counting and Count the Kicks. You need that to help encourage your team. So the next step on the pre-implementation work is to review your organizational policies. Megan shared that she was talking to somebody, I think you said in Nebraska, Megan, and they shared that their current workflow was to educate patients and say 10 movements in 2 hours. So what does your organizational policy say? Other places to look at your discharge instructions and patient education that already discusses fetal movement counting. We've seen a lot of disconnect between what's on after visit summaries, what's on discharge instructions, like patients leaving triage. They don't align with Count the Kicks education on fetal movement, because they're just like historical kind of like just standard text on that. So maybe wanting to be a little more detailed in that. So check out your after visit summaries, your discharge instructions, and any workflows or policy around when to provide education. The organization that I came from had a specific workflow around when different education was provided at different prenatal visits. And so where does the Count the Kicks education fit and thread through your prenatal education? If you're an inpatient facility, like, are you educating every patient that comes to triage at discharge about fetal movement? And you might be, but are we all doing it the same way? And so looking at that and looking at what our workflows look like. If you're in childbirth education, looking at your handouts, pamphlets, education booklets. So you might be using some different booklets, just making sure that they all align, and updating to make sure we don't confuse patients with different instructions at different places.
And
After
yeah,
you kind of,
Adrienne, this is Megan again. I'll
yeah,
just add too, if any of your health systems are using a patient platform like like a portal that they could use similar to like a baby 360 or something like that. And if they have fetal movement, like education, what does that platform have too, that we can work together and make sure that they're using up-to-date information? That's another avenue, as we should mention that here too.
Yeah, so you could connect with Megan and she might be able to connect with that organization so that you don't have to do all the lift yourself.
Yeah.
Because obviously that would be helpful for lots of organizations to have standardized education on this. So if you find that there's a disconnect in some standardized education that you purchase or you're involved with, then reach out to Megan and she can chat with you and maybe the folks at those places. Um, After you've kind of done this initial review, I think it's time to gather your key stakeholders to gain buy-in, answer questions on fetal movement counting and the Count the Kicks program before you do a widespread implementation. So thinking about what key stakeholders need to be on board with the implementation on the initiative before widespread sharing. So I think of just childbirth educators, residents, nurses, OBs, MFMs, they to me seem like the initial key stakeholders, making sure they all feel really comfortable with it, inviting them to a meeting, educating them on Count the Kicks and answering any questions, seeing if they have any barriers that they think are going to bubble up, during implementation. So after you've gathered your key stakeholders and had this conversation with them about Count the Kicks, because if you don't have that meeting, sometimes what can happen, and I'm sure you've run into this with other implementation initiatives, is you're very excited about this, you're completely bought in, you educate your nurses or your health workers or whoever it might be, and then as you're doing it, one of these key stakeholders is like, what? Why are you doing this? And they are educating a completely different way, which creates challenges for your team as well as for the patient. So gathering them ahead of time is really helpful. The next thing that I had on here is creating your standard work. And I gave you two examples of that. One, an inpatient version, and one is an outpatient version. These are samples. I in no way think that these can be plug and play for your organization, but I'm hoping that you'll think they're getting pretty close. Megan helped with some scripts. Standard works are one of my most favorite quality improvement tools. I don't know how many of you use standard work for lots of things, but I love them. I think especially in this day and age where we have a lot of newer nurses or people that might be new to the specialty or a lot of turnover in our workplace. Standard work is something that you can share with those that are coming on new, and it's standard, it's unchanging. I think this is perfect for Count the Kicks, a perfect QI tool for Count the Kicks, because we're not changing this up every time. We should be doing it the same way, using the same type of scripting. They don't have to read the script exactly. It's just to give them some structure around how to do this education and when to do this education and where to document it. So please, I'll pull up the standard, or we're going to go through the standard work in a second, but I think it's an amazing tool. So after you've kind of done this pre-work and you feel, you have your key stakeholders engaged, you feel like you've done this back work to make sure that education is aligning across your discharge instructions in your EHR, in your policy, and your key stakeholders are engaged and ready to go. It's time to go live with your team. So that's our implementation piece. So the first, you're going to start with, educating your team. So you might consider doing this as a staff meeting, just thinking about when do you have everybody around, because that's a hard thing to come up with. But ahead of that meeting, you might want to consider having a survey or some informal discussion with, some EB key members of your team or your team to say, okay, what are some of the gaps in their knowledge around fetal movement, stillbirth, and fetal movement counting? I think that it would be really interesting to survey them and ask, or in a staff meeting, just say, hey, so tell me, what's the language you use when educating your patients about how to monitor fetal movement? I think there will be significant variation, and that variation, that conversation around the variation that they have in how they teach fetal movement monitoring will help to spur the importance of this education. I think we can easily, encourage people, and they'll see that we need to all be on the same page. The urgent maternal warning signs is one of those tools that came to us because we all need to be on the same page, talking the same way about these key urgent signs. And so this is kind of just a piece of that conversation. So once you've kind of done some of this informal discussion and about like the variation that exists and why we need to use this standardized workflow to talk about fetal movement monitoring, I really recommend that when you hold the team meeting, start with a patient story. I love using a patient story in all my QI work. I always start with one because we all got into healthcare because we wanted to help people. And I think that when we start with the why, when we start with we are doing this, reminding us we are doing this, we are engaging in this for our moms, for our babies, to to help them. And so centering it around that, I think will bring you increased engagement from the team, and help them to say, okay, yeah, this is something I want to go all in on. You can give some more education on the why by talking about the science and the professional societies kind of recommendations. And so we did link those documents in here with A1, and then up above in the like kind of front matter of this document, you will also find additional links to other professional society guidelines like AMCHIP and AIM and ACOG. So you can check out those references as well. And so then after you talk to them about, the human part of this, and then the scientific part of this, and then, provide them education on that variation, and that's why we're doing this to remove the variation, and then educate them on how to do count the kicks. And that's the part that Megan dug into with the steps of how to talk about fetal movement monitoring using count the kicks. We did link a little video in there. We would encourage the team during this education to download the app so that they have time to feel comfortable with it, so that they can use this in their teaching with patients. I know that I've heard some folks who do home visits have the app on their phone, and they go out to the home visit, they show it to the patient and then work with them to help download it. And then, I think a great thing to do in the training that you hold would be using some role play. So we did write a role play for you. It is linked in here for you. And it has the Count the Kicks nurse champion, you, working with your nurses to train, excuse me, it has the nurse with a patient and works them through a scenario of how they would be educating. So I think that would be a great thing to do in that meeting. During that education with your team, we would suggest that you share your organization's standard work, which we gave to you, but you would update that to align with your organization's specific procedures. And that would help them to have a reference on how they would do that moving forward. So that's kind of, we outlined in here, you can refer back to this, but how you should, roll out the best practices and how you should roll out this training with your team. And then once you've done that training with your team, the next step would to be go live with your patients and families. We, say pick a go live date, start publicizing it with your team, ensure that they're all feeling good, that they reviewed that standard work, everybody's on board with it. And then, start to hang those posters for Count the Kicks, which sounds like many of you already have in patient-facing areas and waiting rooms, and then celebrate this go live. And if you've already been go live, I don't want you to think like this is lost. My recommendation is if you've already gone live with the materials, I think that's great. I would recommend at your next, staff meeting, bringing everybody together if you haven't already and have some standardized training around this. Do that role play like we suggest. And then you can all, do a relaunch. Relaunch is really common in quality improvement. Sometime the first go round we do it, but we want to like really give it that extra umph. If you do this relaunch, like consider celebrating the go live, put up yellow balloons or something like cookies with yellow icing or something fun like that to just kind of celebrate this and really encourage and have patients asking like, oh, what are you all doing? And make it like a conversation starter.
So I'll just add to Adrienne really quick. Part of my role too is I've worked with health systems in like their marketing department and their communications department to create or draft like verbiage of one for patient facing, but also for provider clinician facing too, as you start to share this. So I'm happy to do that. I've also done like grand rounds, virtual, as much as I'd love to come visit you in Maryland, but I can do virtual visits pretty easily too nowadays. So there's just you utilize Adrienne and myself for some of those pieces too. We're here to help.
Yeah, between Megan and I, I've done education at a lot of different organizations across Maryland. So if there's someone on here that would like one of us to come, between the two of us, we usually can, or together, we can usually figure out uh, a day and time that works for all of us to do that education. But I think celebrating this, making it fun, you can
Take
Megan's team.
photos.
I'm sorry, what?
Does it take photos? Tag us on
Oh,
social
yes.
media. Like we would love
Megan
that.
loves a photo. She loves
The
a
photos.
photo. And then the other, thing is that Megan's team, they do have social media posts. I think she kind of referenced that, but that if your organization is doing this, that you can get it out there on your Facebook or your LinkedIn or whatever it is, Instagram, whatever your team uses to kind of say, hey, look, we're doing this. Because again, we want every patient, every family to know about this.
Right.
So if you feel like you've already really your team is all on the same page, everybody is educating the same way, we do want to evaluate that because with any quality improvement initiative, we know that over time things start to lose their fidelity, so to speak. So what I say there is that, if you think about lots of issues like infection prevention, CAUTI, CLABSI, all those hospital-acquired infections, we've been talking about those for years, but they still come up as things we're trying to fix, even though we've done tons of initiatives. So just like with any quality improvement initiative, if we don't keep our foot on the gas, we start to kind of revert from what our initial intent is. So as the Count the Kicks champion, you do need to evaluate the, continued implementation of Count the Kicks. So it doesn't have to be you who does all of this. Please definitely delegate, assign. We want as many Count the Kicks enthusiasts as possible at your organization. So the more, the merrier. But one, monitoring the availability of your materials. You could have ordered those materials and who's paying attention to make sure that they're still stocked and the ones that you're using the most are available. So make sure someone is dedicated to monitoring the stock of the Count the Kicks materials. Continue to remind staff about the initiative and provide regular education and updates. You can include information in staff meetings, monthly newsletters, however it is that you communicate with your team, because it can't just be a one and done, like, oh, we did this great education and now we're done with it. So it needs to be something that you continue to chat on. Really, the best practice would be auditing the provision of patient education monthly against your organization's standard work to ensure that standardized education on fetal movement is being provided. So how are you doing this? If you decide that you're giving it at, let's say, every prenatal visit or at discharge from the hospital or whichever way, are you expecting your team to document it somewhere? So you may want to choose a random sampling of charts and look to see, is it documented that these patients receive that? If you're able, amazing to have it as something that you document in like a flow sheet row in your electronic health record, and you can pull that out. we know that just handing them a brochure or just sticking it in the discharge instructions is not going to get us our desired result. So we need our team to be continually engaged. We also want to celebrate this. As your teams start to do this and achieve your goal of providing education to all patients, celebrate it, talk to them about it. And as we already mentioned, considering posting this information to Count the Kicks on social media to increase community engagement. Because we want to get those grandmas and grandpas engaged too, and sisters and aunts, everybody should know about fetal movement monitoring. Because one of the things that I found in the research when I was working with Megan and Sarah was that, and I think you'll all agree, that when we have something go on in our pregnancy, the first person we usually call is either our mom, our sister, or our friend. And we're like, hey, is this normal? Do you think this is right? Should I go to do you think I need to call my doctor? And so if you're calling, your mom and they're like, just sit down and rest, drink some juice, and that's what they're used to, then that's probably what they'll do. So we need to be educating everyone on this, not just birthing people, but communities, so that they'll understand the importance of it as well. So some best practices for educating patients: introduce the concept early. You can talk to them in the second trimester if you're not sure if when you're gonna get them back. We want it to start early in the third trimester. So if you have them around at the 24-week visit, or their visit's a little bit late and they're not going to get back to after 28 weeks, then definitely consider having this conversation with them about fetal movement monitoring, making sure we're incorporating the topic into routine care. And we are following up. So if we talk to them about it at 28 weeks, then at our next visit at 32 weeks, we are going to say, hey, how's it going? Is everything okay are you doing that fetal movement monitoring? Continuing to bring it up, because we know with education, one time doesn't always stick, but multiple conversations are helpful. Have those education materials, posters, brochures, app information, everywhere and available, hanging them in the waiting room, exam rooms. As far as labor and delivery and triage, reinforce the importance of fetal movement monitoring to patients presenting for triage any reason in that third trimester. Ensuring patients are aware of what to expect when movement is reduced and the protocol for contacting the healthcare providers. That is a really big one. And I just want to reinforce that for all of us on this call, I think most of us would say, oh yeah, we know that if something happened in the middle of the night, we would just call our doctor because we know they have an answering service and somebody's going to pick up, or we would just come to the emergency room. People not in healthcare don't always know that, especially patients that may not be from the US, may have different standards of care in their home country. It's important for us to continually reinforce that it is okay to talk to us outside of normal business hours, and what they should do if they have any issues. And that transcends fetal movement. That's all urgent maternal warning signs. So, reviewing with them how they can share their counting data with staff, and really providing them with that support and reassurance on when to seek immediate care. I love my childbirth educators on the call. I'm a long-term childbirth educator, so definitely think this is a way that we should be able to thread this in. Definitely taking time during the class to download the app. If anybody on here does centering pregnancy, another time when you can embed that into that workflow and have them download the app as an opportunity. So I think all of these are just some examples. There's tons more. Right? We didn't talk about home visitors or all of those places where this can be embedded. So I think those are amazing opportunities. Technology, depending on how connected you are with your information technology team, there's a lot of potential here. Count the Kicks reminders can be embedded in your patient portals, in text systems, in apps. I think the lowest hanging fruit is really around just making sure your discharge instructions are aligned with what you're teaching. You can have automated phone calls. So different health systems across the country have kind of embedded this with technology in different ways. And Megan is really the resource for that. So if you have questions about that, definitely reach out to Megan and she'll be able to help you think through some of that. Collaborating with community. So I know that some of you are from the community, which we so appreciate, working with local health departments, FQHCs and other clinics to make sure that materials are available in all different places across your system. So if you're a hospital-based program and you're unsure if your, community clinics have the materials, definitely reach out. Let us know. Like I said, these materials are all available free of charge. To you all. So they're there for you. And continue to touch base with the Maryland Patient Safety Center. Like I said, I track this data at a state level, and just kind because we are funding this, we get some data on how many have been ordered and the app downloads. So I just want to keep seeing those app downloads and the orders continue. So I'm not going to dig into all of this just due to time, because I want to give some time for you all to answer questions, but please take a look at these sample standard works. So they're embedded in the toolkit, but I also gave you the Word version. I gave you the Word version so that you can edit them freely and help for them to align with your organizational workflow. One is for the inpatient unit. So I created one that I thought could be used for like folks on the call who are hailing from OB units who have OB-EDs or triage and are seeing patients who come in the third trimester. Another one is an outpatient one. So it was built a little bit around thinking through a prenatal care process, like a patient presenting for prenatal care, what type of conversation, but it could be just as easily kind of redesigned for a home visit. If you're a childbirth educator, you might not need a standard work, but thinking about where that education fits in your curriculum. If you have a 3-week class or a 1-day class or a 5-week class, how you're talking about fetal movement monitoring. So the standard work, for those of you that aren't familiar, essentially just has process steps. It has a column for who is supposed to be performing that task, any key points, and then a place for diagrams or workflows. And you would make this as specific as possible, meaning like if you have a place where you want people to document this, then you would take a screenshot of in the EHR on a paper form where you want people to document related to fetal movement or educating on fetal movement and putting that in that pictures and diagrams section. We did try to fill out and give you as many resources and references in here as possible, with links to where to order materials down to, links to AIM urgent maternal warning signs. And then some of the things in red are what, our thoughts are around some scripts. Like number 4, educate the patient on how to download the mobile app. Megan went through and wrote a whole script on how how a nurse, a provider, a community health worker could say this to the patient. So we tried to make this as seamless and as possible and remove as much work for you all as possible in trying to create these and give this as a reference and a resource to your team as far as the expectation around education. So you'll find 2 of these in this toolkit. And then we also have, I'm going to scroll for a second. Sorry, I'm going to make you hopefully not get dizzy, but we also have a role play script. So as I mentioned before, we have a role play on how to educate, how your team could get educated around doing this education to patients. And so we have one that's a prenatal visit and one that is a inpatient type of visit that's here. So this is all just reference resources for you all. I hope that you find that it's helpful to you in implementing it. Is there any I'm trying to think, Megan, what else did we want to go over with them? The tools. I think we kind of went over the tools. Do you all have any questions for us about implementing this, or questions about the toolkit?
You can raise your hand or put it in the comments or unmute. Um, we have a lot of resources too. Like if you'd like to be like a formal Count the Kicks champion with a digital badge and our social media toolkit, I can work with you on what that looks like and individual health system wide. Happy to do that. Um,
One of the things that I really love, I love the badge buddies. I was just looking to see.
oh
We
yeah,
had
just pull up your
Let me sh-
PowerPoint again. We
Yeah,
can.
let me share that. I would highly recommend, if you don't already. I know I had previously a stock of badge buddies. I think at this point I have given them all out. I will go back. Can you see
Yeah,
it?
that's good. Yeah, so these are just some additional resources, kind of what we've already talked about, but what she's circling there with her cursor is what we call a badge buddy. Do you all know what a badge buddy is? It just goes on your badge, and they usually come with the Count the Kicks clip as well. On one
I have
side,
the Count the Kicks clip.
there you go. On one side is the QR code to download the app, and the other side is kind of like a mini cheat sheet of talking about Count the Kicks. So you can just say, here, scan this QR code, and you can download the app. It'll take them to it. So if you would like these materials, there is a slight cost to them, so you'd have to contact us. But I do have health systems reach out and purchase this. Think through your foundation. I'm happy to help write grants. That's part of my role too. And then the wristband that you see, it's kind of hard to see there. That's actually my sister when she was pregnant with my nephew. But on there is numbers 1 through 10 and then a slider. So those that maybe aren't as tech savvy, or they don't always have access to Wi-Fi, or they just really want a reminder. We have these fetal movement monitoring bands that you can use with our paper kit county charts too. Then there's our after visit summary gold standard verbiage. I can send that to you as well. And then there's just an example of one of the posters that goes out. I think one thing I wanted to mention while you're all, feel free to raise your hand or add questions in the chat, is when Adrienne was talking about when to address, fetal movement monitoring, and you can do it in the second trimester. I think one thing that I have found with talking to just patients and lost parents as well as providers and systems is, most that I've talked to give out some sort of like binder or a bag when you first come in for your 10-week, 11-week, whatever you invite them to come in for their first appointment. And that has things all the way through their full pregnancy. And they'll put the Count the Kicks information in there, which is great. But then that's all they'll do. Like, that's all they'll talk about is they're like, well, we put it in there. I will share this really quick story. There's a woman, a lost mom, who said, this was in Iowa, and she's like, I was putting away my stuff after the loss of my son, and I pulled out this binder that I had been given, and I didn't even get to the third trimester, right? Like I lost, in 26 weeks or 24 weeks, I think. And she's like, but why didn't I see that early? Why didn't I know about this as I could? She was counting a little bit earlier, but just that communication is a little, we want to really think through that. So one of the other tools that we have is this digital resource where you can share this with your patients, because a lot of times we get asked, like, how do I digitally share the brochure or the poster? Unfortunately, due to copyright, we can't do that, but you can share this digital tool. You can also work with us if you'd like to embed this in your website. There's opportunities for that. Many of my clients are only reachable by email. How effective is it to send them the Count the Kicks information? I think you could easily create a little note about Count the Kicks to this person that put in the chat and say, hey, I want you to visit this website. Here's a link. Here's a link to a YouTube video to watch. Like, use some of those tools in there. Those are all free that you can access and send to them to watch and do. I mean, a lot of times we get people who haven't been told about Count the Kicks from their provider, and they just found it on social media. So I think that's an opportunity for you to share that in email form is totally fine.
I also would say, I'll try to get the link. If not, I can send it out. The Maryland Patient Safety Center made some, I'm going to call them YouTube shorts or TikToks, but
Yeah.
it's on YouTube on our website, and they're these little short like educational videos, and we made one on Count the Kicks and how to do it, and it's maybe a minute and a half long. It's really nice. So that could be another option to send them, and they might be more enticed to click on it because it looks like a little TikTok, and
Mhm.
it hits the mark.
Yes. Yep. I can't find it fast enough, so we'll send that out.
So we will follow up with some of the resources that we mentioned. Does anyone have any final questions? Then I'm gonna end us with Sanara's story, and so you can see a success story.
She is his best thing. She is a happy baby. I am so thankful she got here safely. I hadn't felt her kick all day, but what I did feel was hiccups. And I'm like, okay, Destiny, she's alive, because I can feel her hiccuping, but I don't know, in my head, I'm just like, something's just not right. It gave me a guide for something that I could do this time. And at this time, I feel like I had learned her. Like, if I drank that day, I tried to drink Pepsi. I tried to get some candy in me, and I mean, she wouldn't budge with the Pepsi, the candy, nothing. I still hadn't felt no kicks. Got in the car by myself, didn't even wake anybody up, because I'm like, oh, everything was fine last night. I'm sure it's just me being paranoid tonight, and they're gonna send me back home tonight. The next thing I knew, I was in the operating room, and she was out within about 30 minutes, and she made the cutest little cry. I'm so glad I counted my baby kicks, because if I didn't, they were telling me that I probably would have lost her, just like my first child, if I didn't go in. That night I did. Count the kicks, I mean, it helped. It really did. It saved my baby's life. It really did. I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Listen to yourself. Listen to your body. Listen to your baby.
So we'll leave that there, because I think that's the whole point of all of this, that we just want to empower our patients to have the tools they need to speak up and to listen to their bodies. So we will send the recording out to everyone and the resources we discussed. If you have any questions for us, do not hesitate to reach out. I think you all have my contact information, and Megan's contact information is in the toolkit. We hope that this was helpful to you all in your implementation journeys, and that we continue to see all of the app downloads increase, and of course, stillbirth decrease across the state of Maryland. So thank you all, and we hope to talk to you all soon.
Thank you, everybody.